Good morning from the Hawaiian Eye Conference in the Big Island of Hawaii. We're pleased to be here today with Dr. Peter Kaiser from Cleveland, Ohio. Thanks a lot for being with us this morning.
My pleasure. Thanks for having me.
I'd like to speak with you this morning about anti-VEGF therapy for various retinal conditions. I understand that there are some novel developments and some new agents that we'll be looking forward to seeing in the anti-VEGF sphere. Can you tell us a little bit about that?
Absolutely. So, the issue with anti-VEGF is they work super, but oftentimes either require monthly or bi-monthly dosing. This year, we hope to have approval of two new drugs, anti-VEGF drugs. One is called brolucizumab, and one is called abicipar. And both these drugs do several things. They extend the durability of the drug so we can block anti-VEGF for an extended period of time. And in fact, in the clinical studies, most of the patients in the brolucizumab study went to 12-week dosing interval with similar efficacy as we have for aflibercept. And in the abicipar space, there was actually a 12-week dosing arm. So for us in retina, where we had a monthly treatment and an every 8-week treatment, hopefully by the end of this year we'll have an every 12-week treatment, and when we use other treatment regimens go even longer. The other thing that's kind of cool is we're starting to look at different polymers and devices. So there's a device called a port delivery system, which is surgically implanted, but actually in the phase 2 is able to go every 6 months between treatments. And so we're starting to really move the bar towards extended durability of our treatments, but get the same visual results.
Well, this brings up some great questions, Peter, about logistics of patient care. And I wonder if in the past we had been using anti-VEGF agents every 30 days or every month. The patients had been coming into the office every month. With a more extended duration of action of the anti-VEGF agent, 8 weeks or 12 weeks, do the patients still need to come in every month for follow-up, or are you able to extend the duration of their follow-up visits also?
Yeah, that's a great question. The answer is the studies show that we don't have to see the patients in between. Certainly, if it's a patient you're concerned about, you can see them. But the studies have shown that we could actually go a full 12-week interval between actual visits. And the other thing we're actually working on is home monitoring devices, where the patient either has a home OCT, actually, which is something really cool, and using artificial intelligence will tell us as well as a patient, hey, guess what? Time to go back to see your doctor.
That's a great technology, and certainly something that would be very exciting, especially for patients that may live very far away or have a hard time getting into the office. One other logistical question, Peter, is about bilateral treatment. Let's say your patient requires bilateral anti-VEGF treatments, and you're using one of these newer agents that works for 8 or 12 weeks. Are you able to administer that treatment in the same sitting, or should the patient be coming back for a separate visit for the fellow eye?
Every doctor does it a little differently. In my practice, we do bilateral injections. There are certainly many doctors who don't want to do that, worried about side effects and things like that. But, bilateral injections have been shown to be very safe, efficacious. The big issue with these longer durability drugs is if you get onto a weird schedule, right? So then you may be seeing a patient, say, every month, but alternating eyes because of just a 12-week interval. In general, when that occurs, we try to sort of synchronize the two eyes, but it doesn't always happen.
Well, this has been a great update for us, Peter, about the novel advancements in anti-VEGF therapy. We're so excited to have your expertise, and thank you for being with us.
Thank you.
That's great.